Hello, I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. Today, we explore what we have learned from the opioid epidemic. The fentanyl crisis, opioid settlement funds stuck in the limbo of state politics, and a need to understand why the fatalities are continuing at an alarming rate in spite of our best efforts. These are some of the issues still left unresolved. Rod and Debbie Courtney lost their son to fentanyl poisoning and have dedicated their lives to a campaign to heal the damage opioids continue to inflict on Iowans. On many human levels, they are some of the most expert and knowledgeable authorities on the opioid epidemic in Iowa. Welcome to the show, Rod and Debbie. Tell us a little bit about yourselves.
Well, thanks, Peter, first of all, for, allowing us to be here and to be part of this discussion. I'm Rod Courtney, obviously, as Peter's already introduced me, but I'm the executive director here at Crush Recovery Community Center, which Deb's going to talk a little bit more about in a moment. But we're a peer-run, peer-led organization with peer recovery coaches, and I like to say that we meet people where they're at, and we don't leave them there. So, go ahead and pass that on to Deb.
Hi, Peter. Thanks for having us. My name is Debbie Courtney, and I am the Assistant Director at Crush Recovery Community Center. We lost our son, Chad, on November 1st of 2016 to an overdose, a fentanyl overdose. And he was 38 years old, married, and with 2 daughters. From that time, we didn't know which way to turn. We were devastated. Trying to find a support group, trying to get help, some way to cope with what had been 24 years of walking alongside our son with his substance use disorder. So during that time, Rod came home and said, we're going to start our own support group. That's what we're going to do. And so we did. We started the Crush Family and Friends Support Group, and we met during Zoom during COVID, and we went around the state, told Chad's story, and then in 2021 over Christmas, we both had COVID, and we sat at the kitchen table and we wrote a grant and requesting funds to open a recovery community center. Would have been the first in the state of Iowa. And we got awarded those funds. And in June of 2022, we opened the Crush Recovery Community Center. Crush stands for Community Resources United to Spread Hope.
Now, this is a journey I've been able to share with you and see in action. But it was tough. I mean, you were dealing with grief, and I know you went out there and found that there were no resources. There wasn't much going on. It was like there was this hurricane or a tidal wave, and it was affecting millions of people around the country, and yet it's as if the problem didn't exist in many ways when it came to resources. When you ran into that barrier, how did you feel? And what were some of the first steps you took?
Well, I'll take that one, Peter. It's like, I think, you're pointing out, you say, we were already dealing with the death of our son, but we're coming off a 24-year battle, of trying to find resources and coming up short. And, I've been in the human service field for probably almost 40 years. And I was familiar with the system. So I knew that there were already voids and gaps in services. So when after Chad's death, we started to think about how we could do that. And I kind of losing my space here. Remind me of the question.
Well, I mean, now this is exactly, I'm sort of glad that you got to that, because this is what happens if you're trying to deal with grief.
Right.
At the same time, you're plotting a course forward. And we were talking about some of the first steps.
Yeah.
And you decided to create your own support group.
Yeah.
And what was that process like early on?
Yeah.
What were those first steps?
Yep.
Can I add something?
Oh,
Can I
sure.
add something really quick? Tomorrow's or on Friday is Chad's anniversary of his passing. So I think too that Rod and I are affected,
Yeah.
so
Yeah.
that's all
Well,
I wanted
God
to say.
bless you because it's very brave of you to be here. And you've been
Yeah.
brave as long as I've known you to share your stories so other people don't have to go through all the things you had to go through to find
Yeah.
help.
Yeah. And I think probably what I just did is like when I got caught up in those thoughts and those emotions when we go back, because it'll be 8 years that Chad has been gone this coming Friday. And it's just that whole idea of that whole flurry of emotions and thoughts that just come back. But out of that was a genesis for Crush. Because when you're feeling lost, you're trying to find some common ground someplace. You're trying to find people with shared experience that will understand. And Crush was able to do that. I'm a person in long-term recovery as well. So when I heard about recovery community centers and what they can provide, it's like I'm in. This is what I this is going to be a solution to a lot of things. And I still really firmly believe that this is the beginning. This is a recovery movement. We're moving away from we're moving away from uh, clinicians, and I'll never. So we understand the importance of clinicians, but people with lived experience are bringing a whole lot to the table. So I just, it's this is a great opportunity to be able to share a little bit about that.
And such an important point, that lived experience. So we're going to take a short break and we come back. We're going to continue our conversation with Rod and Debbie. Stay tuned. You don't want to miss this.
Well, because it's the best. And that's true because I've thought about that. I mean, definitely the fastest. And the biggest thing I hear most people talk about is the stability of it.
MediaCom's network is very reliable. We have a lot of programs in place that can monitor kind of issues that arise. That way we can fix them before they reach the customer.
Trust the pros. Get Extreme Internet starting at $9.99 a month for a year.
Watching MC22 is now easier than ever before. All MediaCom customers can watch local programming online anytime. Go to mc22.net, click Watch MC22, and log in with your MediaCom account. Not a MediaCom cable subscriber? MediaCom internet or phone subscribers can watch too. Your local programming leader, MC22, online at mc22.net/watch.
Welcome back to Surviving Bad. We're speaking with Rod and Debbie Courtney from Crush of Iowa about the damage the opioid epidemic continues to inflict and what can be done to prevent opioid abuse and heal a hurting population of Iowans. And I think let's first start by bringing this into perspective for us, Rod. When I talk about a population of Iowans, this is not a small number of people dealing with these problems. What's the scale of this issue?
I think the scale is yet to be known because so we went through the opioid epidemic as in like heroin. So we went through that and heroin usage just dropped substantially. But now you know what we're looking at? We're looking at fentanyl. We're looking at fentanyl, we're looking at methamphetamine. So it's this whole epidemic, which is still very much with us, has evolved into usage with there's fentanyl and a methamphetamine, and fentanyl and methamphetamine are running neck to neck. So now we have a whole new beast. That's what's happening here on the street. And my fear is like when you start talking about population. So you have a population that's going to go from high school kids and under that think they're getting a perk 30 that they got from their parent, that it was a prescription, so it's safe, and it's not. It's been made in a pill mill. It is in really on the street. What they talk about here, if you get a perk 30, it's just fentanyl. So for a lot of kids, the natural curiosity, I mean, first use can literally be last use. And for people that have enjoyed a period of sobriety and not using, and then they go back and they go back to using, well, the whole landscape is different now. So it's just different. It's evolved, and I think it's just going to keep doing that. So there's uh, there's not a population that is going to escape. There's not a demographic. There's not an age group. There's not a gender that is really safe from any of this. If they're not using, they're going to be impacted by they're going to love somebody or know somebody that has either had an overdose or passed away from an overdose.
Now, you work with a lot of people that have been dealing with these issues and are getting help from your center. Um, you know, a lot of really good people from every economic strata have encountered this, and we're starting to show a trend towards correlating substance use disorder with mental health issues. Is this something that you see as consistent with what you're finding in the people you're dealing with?
Absolutely. It's absolutely. I mean, I don't have an exact percentage, but I'm confident probably 90% of the people that we have opportunity to work with or spend time with have some type of comorbidity between mental health and substance use disorder. And the idea that the behavioral health, I mean, the realignment with behavioral health services, I'm hoping will help that, because now we're not siloed. Now it's behavioral health. So when you look at one, you're going to have opportunity to look at the other. But no, it's hand in hand, and substance use disorders, brain health, all those things. Then there's so it makes sense this, but then there's that chain reaction. Those are the people that are filling up our jails and institutions. So it's like I heard a number at an event the other day that probably 80% of the people in our prisons are on meth charges. So finding a way to um, address this, and people with lived experience, they're the folks that, no matter what your demographic is, that those are the folks, in my opinion, that are people are most comfortable with on the front end of this.
Now, if we
I
look
think-
at Iowa, oh, go ahead, Deb.
Oh, I was just going to add that since the time when Chad passed away, he also had he had a substance use disorder and also mental health that he dealt with. And it was always a challenge for us because we would take him to a hospital to get treatment or to get help. And depending on the doctor, maybe they wouldn't want to see him because, well, he needs to be seen by a psychiatrist or by a mental health person. Oh, no, wait, I can't see him. He needs to be seen by someone with substance use disorder, so we were always juggling this, issue with him that needed to be taken care of jointly, together. So I'm really hopeful that that's what's happening as we realign the system and stuff in the state of Iowa. So,
I want to talk about that. So let's take a short break and come back and talk about the system and how we can work within it to help improve the outcomes for people in Iowa and maybe get a healthy dose of prevention as well. See you all after the break. You don't want to miss this.
Watching MC22 is now easier than ever before. All MediaCom customers can watch local programming online anytime. Go to mc22.net, click Watch MC22, and log in with your MediaCom account. Not a MediaCom cable subscriber? MediaCom internet or phone subscribers can watch too. Your local programming leader, MC22, online at mc22.net/watch.
You told me not to talk to strangers. You told me not to cross the street without looking both ways.
You told me not to touch the stove.
You told me not to do drugs.
You told me not to drink and drive.
You gave me so many messages about how to stay safe. Why didn't you keep me safe by properly storing your gun?
Welcome back to Surviving Bad. We're with Rod and Debbie Courtney, and we're exploring ways to help guide Iowa into a future where we have a chance to stop the opioid epidemic and help countless at-risk Iowans get the support and treatment they need to heal. Debbie, tell us a little bit about how this started and the number of people you've done and what we see as could be the potential for this effort.
Sure. So when we first opened the doors in 2022, and we're an all pathways approach. So, whatever works for you in recovery, we're going to walk alongside you, and what works as opposed to you need to do this, we're going to walk with you what works for you. And when we first opened the doors, that first month we had about 200 people, and we were ecstatic. We just thought, oh boy, this is working and we're feeling good. Well, jump forward now. We've been open about 2.5 years, and we do outreach. Right now we are in the one of the hospital's ED, so that if they have someone come in, they call us and we send a peer recovery coach down to meet people where they're at. We go into different centers like the Heart of Iowa, Catherine McCulley. We go into Department of Corrections at the women's facility and the men's facility. We also are in drug court. We have a peer recovery coach in drug court. And then we do different things out in the community, like events and just going and telling Chad's stories still. And this last month, counting all that plus the people that come in, we had contact with, we usually do about an average of 1,800 now a month. Sometimes more, sometimes a little less, but about 1,800. So, we feel pretty good about that. And I think Chad would be pretty proud of that.
Those are numbers to be proud of because you've done that from zero to where you are today. Now, the next question we talk about is capacity. We have this wonderful public health model, and God bless them for looking to knock down the silos. Mm-hmm. But capacity is not just saying you're going to do it. It's actually doing it. Now, there has been all these opioid settlement funds, and boy, we've seen a lot of news coverage on who wants to take ownership of this money when those funds were dedicated to helping the people that need it, not political systems and things like that. Where are we in Iowa with the funding that people need to do more of these things throughout the state?
The opioid settlement money, the bigger piece, and I hear varying numbers, $47 million, but that's kind of irrelevant in the scheme of things because it's millions and millions of dollars. And it's, I have some feelings about the opioid settlement money and the idea of, the lawsuits against Big Pharma. Purdue always comes to the front. And there's always, there's a lot of other folks that were part of that on the early end. But that money initially was meant for the victims. There was that money was supposed to be for the the families like the Courtney family, and now there's a million other families out there that have the same thing. But it got set up in such a manner that the people that tried to apply for that funding, it was such a bureaucratic nightmare that they never had a chance to touch it. And if they did, it came down like $1,500 that they got from that. So then it went to the states. It broke down, and now it's at the states, and it's at the state level. So there's folks like us that are out there and trying and are doing good things. And again, we're operating off a SAMHSA grant. That's a state monitored SAMHSA grant, and so that made this possible. But there's all those millions of dollars sitting in Des Moines. So we're looking at sustainability, because we're a small nonprofit. And we're doing great things, and I'm sure if anybody ever took it to paper and pencil, we'll figure out that we're saving, even here locally, probably hundreds of thousands of dollars every year in providing the services that we do. So it's like, where's that money, and what does the state benefit by just sitting on it? That's my biggest question. 3 years into it, and so if it's a political argument, they're arguing politics over humans' lives and the number of lives that can be saved, and it goes on and on. it baffles me.
Well, not just baffle, it's got to torture you after what you've been through.
Yeah.
Because there are parents just like you
Mhm.
that don't have the benefit of what you've learned or the center that you have. I mean, there aren't centers like yours all over the state.
Yeah.
I mean, how many, if you do 1,800 people in your one center, what would happen if there were 10 of them?
Yeah.
That's 18,000. And I tell you, from what I've heard, if you could serve 18,000 people, that wouldn't be a big chunk of the people that need help. That's
Yeah.
still a small chunk.
Yeah.
And so all
But
this money being locked up, are we getting any feedback from governance about how, because I mean, federal money dedicated to people, now it gets stuck in party politics and government. I mean, do we have any idea what might be happening?
When it comes to that big amount, that big pot of money, I don't really. I don't know if anything's really been said much about it, other than, when you talk with the politicians, they'll just say we couldn't come to agreement. Unfortunately, we couldn't come to an agreement. And then it kind of goes into some of these vague ambiguities about why it didn't happen. And my sense is, if they would engage people from the recovery community, people that have had that lived experience, bring them to the table and say, how do you think these monies can best be utilized? They're going to have the answers. There's a warehouse of knowledge that goes through these doors every day. These people, I mean, there's people here looking for recovery, and there's people in recovery. So we see the whole spectrum of experience and knowledge with that.
All right, we're going to take a short break. When we come back, we're going to ask Rod and Debbie to share some final comments, insights, and inspiration. Stay tuned.
I don't remember how it started.
What's that?
Oh boy.
Our back and forth. It always came back.
Dad!
You probably don't remember what you told me,
That was perfect.
but I heard every word.
Welcome back. I'm your host, Peter Komendowski. And today on Surviving Bad, we explored what we have learned from the opioid epidemic and some ideas to help Iowa heal. Let's see what insights and inspiration Rod and Debbie have to share. Rod, tell us a little bit about this new idea you have for a way to grasp at the problem and understand it better through data.
Yeah, for sure. Thanks, Peter. So this is a new idea for Iowa, at least for people with substance misuse, but it's been used very effectively in Minnesota and Wisconsin. And what they are is an overdose fatality review team. So they literally will start at the time of death, time of the decedent, and start going backwards. And now we're looking at systems. Did they work with Crush? How many times were they at the hospital? How many times were they in treatment? And then we can identify gaps in services, and that will allow us to collectively come up with some innovative ideas, because the people, the fatality review team are going to be, they're going to be the coroners, they're going to be the substance abuse providers, they're going to be community leaders, they're going to be people with lived experience, and we can go back and we could evaluate that. A very, very important piece of this that I really like is what they call next of kin interview. And this is a specialized training for how to do this, because these are people that have lost a loved one. So there's a timing, there's an approach, there's a certain amount of empathy. But I think that if you start having next of kin interviews, I think systemically sometimes we have a tendency to be a little bit too gentle with each other when we start, like the services that we're providing, because we don't like to say, you know what, I fell short there, I fell short here. But you talk to a next of kin, I mean, and Debbie could talk a little bit more about this, but it's like when you talk to a family member that's lost a loved one, or even a family member that has somebody in their family that's experiencing overdoses, they're going to be brutally honest. And I think they're going to be able to tell those of us that are working like in like the human service part, the recovery piece of this, maybe things we don't want to necessarily hear, but we need to hear. So that, I mean, for me, that's the whole idea of the overdose fatality review team is very promising because it does bring in the families, and I hope it's something that we get started here, and probably the sooner the better.
Deb, what's your spin on this?
Look, I agree with Rod. This is about saving lives. This is about making that connection. And if we have to go upstream or downstream and find out where those gaps are at so that we can put a stop to it. Our goal is to meet people where they're at, but not leave them there, and do something to save lives. And that's one of the things that we want to accomplish with Crush. Make that difference for people so no other family has to go through what we've had to go through.
How can people get in touch with you?
We have our website, which is www.crushofiowa.com, and then we're on Facebook. You can see the work that we're doing, and follow us. We have next Saturday we're having our second sober rave. It's a family friendly event. We'd love to have people come down. Well, I guess, yeah, Saturday. So come down, see us at that event, and that's probably the easiest way. Our Facebook page, our website actually has an email address, and it goes straight to my phone, and I will respond.
Now, I know you guys are busy, and I know that you have capacity issues like everybody. But if somebody around the state is watching this, is it okay if they get a hold of you to ask for help?
Absolutely.
Absolutely. I was just going to say, no matter if you're a family member or if you're the person, you know, that needs the help, we're a drop-in center. Just drop in. You know, you don't have to make an appointment with us. Just drop in and we'll sit down with you. We'll talk. We'll see what you need and help you get to where you need to be.
Yeah.
Thank you so much, Rod and Debbie, for joining us today. And thank you all for watching. Check out our website at healthyiowa.org and keep your eye on MediaCom MC22 for our next episode of Surviving Bad, where we explore stories of survival, hope, and inspiration. On MediaCom MC22, your local programming leader.